Okay, hi. Hello. My name is Zulfikri Shah bin Krazmi and my number ID 2020-880-3394. Alright, so today I want to discuss about the aerobic. So firstly, what is aerobic? Aerobic exercise provides cardiovascular conditioning. The terms aerobic actually means with oxygen, which means that breathing control the amount of oxygen that can make it the muscle to help them burn fuel and move. Alright, the aerobic is a sustained rhythmic movement that use major muscle group and puts a constant demand on your heart. And then aerobic, this is a cardio exercise. So the exercise prolonged but at lower intensity. The example of exercise are cycling, long distance, running, swimming, walking. And the type switch of exercise are slow twitch muscle fiber. Okay, what the function of aerobic? Function is a full store in muscle, adipose tissue, and the major fields used vary with the intensity and duration of exercise, like glucosa yearly, FFA, like free fatty acid later. The exercise allow impact the body. Why do we incorporate exercise? I choose the 5 important benefits of body in aerobic exercise. Firstly, improve cardiovascular health. Cardiovascular exercise can also help lower blood pressure and keep your arteries clear by raising good high intensity lipoprotein, cholesterol, and lower the low intensity lipoprotein, cholesterol level in the blood. So the second, lower blood pressure. Cardiovascular exercise may help you manage symptoms of high blood pressure. The thirdly, helps regulate blood sugar. Regular physical activity help regulate insulin level and lower blood sugar, all while keeping body weight in check. Right. And number 4, reduce asthma symptom. Aerobic exercise can help your people with asthma lessen both the frequency and severity of asthma attacks. And then lastly, reduce chronic pain. If you have chronic back pain, cardiovascular exercise, specifically low impact activity like swimming or aqua aerobics, may help you trusted source get back muscle function and endurance. Alright, so just for me. Then can you go through the next part? Thank you.
Continuous training that we do the same activity at the same intensity for the prolonged period of time. Basically, it is more than 20 minutes. For example, like running, swimming, and cycling. It is great because the intensity doesn't change too much, but the disadvantage is it is a repetitive and might be lose interest in it. The duration is more than 20 minutes. Frequency is 3 days a week. It is good if you can do more. And for the intensity is between 64 to 75%. FARTLEK training. It is almost similar to continuous training, which is do one act for a certain period of time. But the difference is the intensity is changed. For example, like in the running, we go from slow jog to run to sprint, then back down again. From that, we can see that there are many varying speed, and FARTLEK training also have varying age range. For example, like cross country and long distance cycling. For the FARTLEK training, the duration is more than 45 minutes, and for the frequency, once every 2 weeks, and for the intensity, it is varying of intensity. For example, like slow jog to run to sprint. Interval training is a type of training where you swap between period of exercise and period of rest. It can be tailored between aerobic and anaerobic, but the specific for aerobic is aka long intermediate interval training, where athletes work at a high intensity between 60 to 80% of their maximum heart rate, where aerobic adaptation are formed and switch to a rest period. It will bring that heart rate way back down. the ratio is 3:1, which is work to rest, and at the intensity suitable for the abilities, it really helps you to improve your performance. For the duration, it is between 30 to 60 minutes, and for the frequency, it's done between 2 to 3 times a week, and for the intensity, between 60 to 80%. Circuit training is a training that do whole bunch of different activity. Each activity is done for a certain period of time or number of repetition. The athlete move on and continue to repeat the circuit to improve the aerobic fitness. The duration is between 10, 20 or maybe more, and for the intensity is 40 to 80%. And the example that I can give to you is a circuit might consist 700 meter on rowing machine, then 3 minutes on treadmill, and then 200 meter sprint on the exercise bike to finish the rest for a short period of time, and then repeat again. The duration might be more than 50 minutes because it consists of many different type of exercise. And for the frequency, it can be done 2 to 3 times a week, and for the intensity is between 40 to 80%.
Respiratory adaptation. Ventilation or breathing rate. Breathing rates increase with higher intensity training. This is more an adaptation from higher intensity aerobic fitness training. This enables more air to move in and out of the lungs, enhancing gas exchange, lung capacity or volume. Lungs increase their ability to expand, enabling a great quantity for air to move in and out. This is a similar adaptation to the increase in stroke volume in the cardiovascular system. Respiratory muscle. The strength and endurance of the diaphragm and intercostal muscle improves. This results in an improved ability to breathe in more air for longer with less fatigue. Aerobic training tends to improve the endurance of respiratory muscle. Capillarization in the lungs. More capillaries are formed in the lungs over time, allowing more blood to flow in and out of the lungs. This improves the uptake of oxygen as there is a greater surface area for blood to bind with hemoglobin. Alveoli. The number of alveoli in the lungs increases to enable more gas exchange to occur. And lastly is the gas exchange. The exchange of oxygen and carbon dioxide improves as the gradient between each becomes larger. This occurs because the more oxygen used in the tissue and the more carbon dioxide produced creates a larger difference or gradient between the blood and tissues. Aerobic fitness training tends to improve the efficiency of the body's tissue at absorbing CO2 and removing CO2. Metabolic adaptation. So the first thing is lactate threshold occurs at a higher percentage of VO2 max, and it improves VO2 delivery, greater ability to clear lactate from the muscles, and lower lactate contraction, and increases in skeletal muscle enzymes. And second, the decreased respiratory exchange ratio from a higher utilization of fatty acids instead of carbs. However, the RER increases from the ability to perform at maximum levels of exercise for longer periods of time because of high lactate tolerance. And also decreased VO2 during maximal exercise from aerobic metabolic efficiency and mechanical efficiency, increased aerobic enzymes activity, muscle store more glycogen, muscle store more triglyceride, and glycogen sparing effect. Increased mitochondrial density results in an increase in the capacity for aerobic metabolism from oxidation of FFAs and CHO for endurance work. Increased capillary density. The first thing is greater oxygen exchange due to greater surface area available and improvements in VO2 max. That's all. Thank you.
Assalamualaikum. So today I will present about cardiovascular adaptation. Okay, let's talk about what happened to heart, blood vessel and blood during or after aerobic trainings. First of all, increase of heart size, or we call it as cardiac hypertrophy. Heart chambers are enlarged, therefore increase ventricular volume. But most important is left ventricle size. So, the function of left ventricle is to pump blood throughout your body. Next one is increase capillarization of the heart muscle. Increase in the capillary density and blood flow to the heart muscle. Next one is increase stroke volume. Stroke volume increase at rest during submaximal and maximal workloads. After that, lower resting heart rate. Lower the resting heart rate, the greater the aerobic fitness level. So, for the formula for this lower resting heart rate is cardiac output equal stroke volume multiply heart rate. Next one is lower heart rate during submaximal workloads. Athletes have lower heart rates during submaximal workloads due to increased stroke volume. After that, lower heart rate during maximal workloads. Heart expend less energy by contracting less often. The next one is decreased heart rate recovery. Athletes' heart rate return to normal pre-exercise level quicker than an untrained person. Maintain cardiac output at rest and submaximal exercise. Next one is increased cardiac output at maximal workloads. Cardiac outputs remains unchanged at rest and even during submaximal workloads. During maximal exercise, cardiac output may increase up to 30 liters per minute for highly trained athletes. So for the formula for this increased cardiac output is cardiac output equal stroke volume multiply heart rate. Next one is increase blood flow to the muscle. Increase capillarization of trained muscle, more effective blood distribution, increase blood volume, decrease blood viscosity, and increase oxygen delivery. After that, decrease resting blood pressure but is unchanged during exercise. From increased blood flow, reducing resistance to blood flow. Next one is increase VO2 max. This is due to increase in cardiac output, red blood cell numbers, a VO2 difference, muscle capillarization, greater oxygen extraction by muscle. Last but not least is increase blood volume or blood plasma with more intense levels of training. It is due to increased release of antidiuretic hormones, increased plasma proteins which help retain blood fluid, and increased red blood cell volume, and last one is decreased blood viscosity. So that's all for me. Thank you. So for this slide, I will talk about hormone response during or after aerobic trainings. Aerobic training stimulates testosterone and growth hormones. So first, testosterone. Testosterone is a male hormone, but women also have testosterone. Women produce small amounts of testosterone in their ovaries and adrenal glands. So the function of testosterone. First is increase muscle mass. Second one is increase muscle strength. Third one, increase aerobic capacity. Fourth one, reduce fat mass. Fifth one, increase bone mass. And the last one is testosterone hormone elevates during and immediately after exercise. So for the next one is growth hormones. Growth hormone, which is released from anterior pituitary glands and located inside your brain. So the function of growth hormone is to make protein for muscle tissue and bone growth. Growth hormone increase during exercise to mobilize fatty acid from adipose tissue into the blood and aid in the maintenance of blood glucose.